For patients and families, a cancer diagnosis can be a very scary thing. There's an entire journey that takes place, and Dr. Mackenzie McGee, a radiation oncologist with OSF HealthCare, is here to talk about how OSF services are here to help. Good morning.
Good morning. Thanks for having me.
Thanks for being here. So what are cancer support services?
So the cancer support services are really a wide variety of things that we can use to help a patient through their journey with cancer. We start with things like nurse navigation to give them a point of contact to help them navigate through the early stages of their diagnosis and treatment. We also want to hook them in with people that can help them with nutrition, like oncology-specific dietitians. We recognize that sometimes getting to treatments can be hard, and so we want to hook them in with social workers very familiar with the journey they're going through. We also look at having chaplains available, behavioral health services, counseling as they're going through this really scary time, and even things like rehabilitation. You know, if there's a limb that's not working well related to their treatment, we want to make sure we get them back to functioning the very best we can.
And why are the services important to patients and their families?
These services are so important to patients and their families because it helps them get to the best place they can be in. So this is such a scary time. There's a lot happening. So much can happen to patients and their families. And if we offer these services, then we can actually help them get through their treatment and try to reduce the barriers that they have getting through treatment for things like transportation or just access to high quality foods, things like that. There are some things that we can do to try to help them through that journey.
Yeah, and is there any way that you can tell that you all may need to bridge the gap or help a patient?
Yeah, so there's actually a formal tool called the distress tool. So it was developed through the NCCN guidelines, and basically it's a little thermometer, and so we can actually ask a patient what their distress level is. And we know that above a certain level of distress that patient is very likely to need additional services to help them through their journey. So we'll ask them real specific questions so we can identify which exact services that they might benefit from the most. But that really helps us get them where they need to be.
Amazing. And how does participating in counseling or therapy services help patients going through cancer treatment?
So going through this is all really scary, and sometimes, patients may not want to do something because it's actually just so scary to them. And so things like even taking a hormone blocker for 5 years for a breast cancer survivor, for example, could be really distressing. Having a counselor help them work through, why it's so distressing can sometimes help them be more compliant with treatment. And exercise can help people really maintain physical activity and cardiovascular health the very best that they can. And then once they're done with treatments, we want to get them back to functioning really well so that they can really move forward and enjoy life.
Thank you so much. And I know, even though this is a very scary topic, the resources seem incredibly hopeful.
Yeah, I think taking advantage of these resources is something we hope that every cancer patient will do, and I think really getting the word out to patients that they exist so that we can really hook them in with services. We just really want to help each individual patient identify what they need to get through their journey and really get back to living life the very best they can.
It's amazing, and thank you so much for joining us today.
We'll
be right back.